My name's Dr. Alyssa VanKeulen, and I'm a pelvic floor physical therapist, and I want to talk to you about how to insert the Bodyotics menstrual disc the right way to protect your pelvic floor. The Bodyotics menstrual disc comes in 2 different shapes and sizes, which makes it great for all body types and all flows. And as a bonus, you can wear it during. But how do you fit this into this? I promise it's not that bad, and I'm going to show you how. The first step is to make sure your hands are clean. And if you want to, you can add some water-based lubricant to the end of your menstrual disc, as this will help guide it in. Avoid using a silicone-based lubricant because it can break down your menstrual disc. From there, you want to find a relaxed position. For some people, this can be a deep squat, sitting on the toilet, or standing with your leg elevated on something. Once you're in that relaxed position, take some deep breaths, fold your menstrual disc in half, and as you inhale, gently insert the menstrual disc into your vagina at a 45-degree angle back towards your tailbone, and gently guide it up until you hit behind the pubic bone. You can leave your disc in for up to 12 hours, but once you're ready to take it out, find that relaxed position again. With clean hands, find the knob of your menstrual disc, and from there, as you exhale, gently glide the disc out to protect your pelvic floor. Empty your disc out, clean it, and then you're ready to use it all over again.